gonna get you checked in for the provider too.
Okay.
Sounds good.
What's your goal for your blood pressure?
Heartburn is my big
How are you today?
Oh, pretty good. How about yourself?
I'm good.
Good.
because I've never had heartburn.
All right, Mark.
Thank you.
Good to see you.
It just sits there like a knot and it won't let go until I stretch it out.
Is it constant pain?
Just about.
Valley View Health Center is a federally qualified health center in Southwest Washington. Tenino is one of our little main street, one doc primarily clinics. It's the only clinic in this town, so if we were not here, the patients have to drive to Olympia or to Chehalis for health care.
Okay, Heather, are you ready for a report on Diane? No rebound, no guarding, straight leg raise was negative.
My name is Heather Novak. I have a doctorate of nursing practice. I run the Nurse Practitioner Fellowship Program here at Valley View Health Center, which is bringing providers into the rural community.
David.
Yes.
Hi, I'm Danielle, nurse practitioner fellow here at the clinic. How are you doing today?
I'm good, thank you.
I've been in healthcare since basically I got out of high school with being a medic in the Army. And I always knew that that was what I wanted to do. High blood pressure puts us at risk, of course, for stroke, heart attack. So here at Tenino, I am like the family country doc, seeing people womb to tomb. So here's something. I'm going to reach over your head here. My handy dandy teaching guide.
Yeah.
Okay. The UW Premera Rural Healthcare Fellowship is a year-long program after graduation, so I'm fully licensed. The fellowship really lets me cautiously and confidently explore my boundaries into my practice and figure out what I can do.
As the provider, you're the person making the calls, and you're responsible for your patients' outcomes. We care about giving them the best care that we can give them, regardless of any barriers.
Is it bothersome today?
Yeah, it's really starting to hurt.
I had never done a cyst removal. Today was my first one, and I think it went well. 1, 2, 3, pinch, pinch, pinch. It's really nice to have the guidance of the preceptors watching over what you're doing and just gently guiding you through it.
Change your approach and see if it comes out anywhere else, just to make sure you get it all out.
We always talk about it before we go in. How are we going to do it? What are we going to use? What to look for? How to educate the patient.
You did a good technique there, and that happens sometimes. An average day in our fellowship program here in the clinic, we start in the morning with a huddle with the medical assistant where they pull up the schedule. What are we seeing this patient for? Do I need you to do a certain test on them before I see them? This is what I think they're coming in for. This is what they've scheduled for. This is what I want you to do with them. Then the fellow goes in and sees the patient. They do their full history and physical exam, and they decide what they want to do with this patient. And then I ask clarifying questions. Our goal is to provide them with the care so that they can live the healthiest life and the best life in their own terms.
Good morning. Hi, my name's Emma.
My name's Gray. We are both nurse practitioners, and we're going to be doing a good check over. We heard you have a sore throat today.
We are at the University of Washington School of Nursing Simulation Center. This is where a lot of the teaching happens for undergraduate, graduate, and our fellows for the UW Premera Fellowship Program.
That one looks okay, too.
One more time, friend. Can you say, stick your tongue out, look really, really big? Yeah, that does look ouchy.
To be able to take that opportunity for students and fellows to continue learning and apply it in rural clinical settings where it directly affects patient care has been pure joy.
Salt is salt is salt.
Yeah.
It's still sodium chloride, and it still can impact your blood pressure.
Okay.
Yeah.
Hi, Diane. Good morning. How are you?
I'm good.
Good.
How are we here? Any swelling? Got some good looking knees. Relax your knees down.
My idea of great rural health care would be to have providers that love their community. They're there to support them and help them, educate them when needed, support them in whatever their healthcare decisions are. I think that's what patients need. They need to have that ongoing support of people that really care about them.
This fellowship is everything that I wanted. I feel so good and strong and confident in my practice where I feel like I can do this for the next 20, 30, 40 years. I don't feel burned out. I feel like invigorated by the whole process. At the end of this fellowship, rural healthcare is where I'd like to focus. Underserved healthcare is the place where I think people need the most help, and I'm called to the challenge of that.
Sorry, it's hard to